That is the power of discussion in Pcpndt. The biggest nightmare when it comes to Pcpndt is a inspection team on your doorsteps. But friends, we don't have to worry about that. If you follow the act properly, there is hardly anything which can happen. There are certain standardized protocols even for the inspection, and there are a code of conduct which have been laid down for the authorities also, how to carry out the inspection proceedings. This is one book where all the inspection proceedings and code of conduct have been released by Government of India. When an appropriate authority comes to you, he is supposed to come with his notification as an appropriate authority and with an identification ID card which he is supposed to show you. The things which an appropriate authority during inspection is supposed to inspect during your Pcpndt inspection: a board which has been displayed there, copy of the act, a registration certificate which is displayed at the conspicuous place, your name on your dress or the apron which you are wearing. Coming to certificate, validity of the certificate of registration, whether it is valid or it has been expired. Name and education qualification of the persons who are authorized to do sonographies, along with equipments, number, make, model of the equipments along with the probes, and he needs to see what all procedures for which the center is registered for. Coming to the records review, they see your F forms, they may see all the forms, they may select few F forms and see it, what they see in F form, whether all the information about pregnant woman has been written properly. They see whether you are submitting the records properly on before 5th of every month. So whatever records you are submitting, the acknowledgement copy of submission of that record is again one part of the documents which you need to keep. Declaration of the pregnant woman which is obtained in the language which patient understands. Consent letters if we are going for invasive procedures. Declaration submitted by the doctor. Referral records, it may be a referral from some other doctor or it may be a self-referral that needs to be kept. OPD register in the format which has been prescribed by the Act, like a 5-column register, and hard copies of all the records. No soft copies are acceptable. You have to have hard copies of all the records, including the sonography images. In those states where the online submission is being practiced, the copies of the online submission are also to be kept along with the records of the patients. For genetic laboratories, the same, only the form E, instead of form F, it is form E. For genetic counseling center, form D is to be kept. Tally of the F form with OPD registers, like for a particular duration, if there are 15 entries in the 5-column register, there should be 15 forms available. The forms should not be missing. And if any lapses are found in your record keeping, then the authorities can issue a show cause notice. And as per section 30, they can complete the legal procedure of search and seizure and record sonography machine, and after that they can file a case with judicial magistrates. Coming to the search and seizures, where the appropriate authorities have the right to enter and search in the registered center at all reasonable times. They can examine all your records which we have just discussed, and they have to follow the provisions of the CRPC for search and seizure operation. Whenever they complete their search and seizure, they have to prepare a seizure memo in which they have to list all the documents which have been prepared and seize the record. Seizure memo is to be prepared in duplicate, one copy of which is to be handed over to the center owner. If for any reason search and seizure operation is not completed, they can keep that in lock and key and can continue it at a later date. This is just has been discussed by the madam, the code of conduct for appropriate authorities, so I will not repeat it. This is compliance checklist for PNDT centers, what all things we should have. PNDT Act copy, registration certificate in Form B, machine registration number, PNDT board, 5-column register, relevant forms which should be completely filled, record and evidence of your monthly record submission, and all records are to be preserved for 2 years. When we come to an individual patient record of a PNDT case, what all things you need to keep? Referral slip, completely filled and signed forms, PNDT procedure clinical report, consent form or declaration form, hard copy of the images, proof of online submission. Friends, whether you love it or you hate it, you have to face it if you are doing sonography. So, my take home message is you should be inspection ready at 24/7. Thank you very much.
Thank you so much, sir.